Principles and concepts of mental health nursing. Health is a state of complete physical, mental, social, and spiritual well being, and not merely the absence of disease or infirmity. Both physical and mental health are interdependent. A nurse who is responsible for total health care of a person must take care of both physical and emotional needs. Therefore, she should develop a basic understanding and skills in psychiatric nursing to achieve total health care. Psychiatry. It is a branch of medicine that deals with the diagnosis, treatment, and prevention of mental illness. Sign and symptoms of mental illness. First is alteration of personality and behavior. Second, alteration of biological functions, that is sleep, appetite, sexual desire. Third, disorders of consciousness, that is clouding of consciousness, drowsiness, coma, qualitative change in consciousness, fugue and dissociation, stupor. Stupor, it occurs in schizophrenia and depression. Fourth, disorder of attention and concentrations. Disorders of attention and concentration. Attention is impaired in anxiety, mania, depression, schizophrenia, and organic states. Fatigue and substance abuse disrupt attention and concentration. Fifth is disorders of orientation. Disorientation to one's own identity, that is, failing to recognize one's own name and identity, indicate an advanced stage of deterioration. 6 is volitional disturbances. 7th, disorders of motor activity. 8th, disturbances of posture and expression. 9th, disturbances of motor speech, that is echolalia. 10th, disorders of perception. Disorders of perception, anomalies of perception are of 4 types, that is sensory distortions, sensory deceptions. Sensory deceptions means false perceptions, perceptual disturbances of time and space, perceptual disturbances of body image. 11th, disorders of mood. Disorders of mood are present in several ways, like their abnormal presence, abnormality in depth and duration, inappropriateness, and their abnormal swings. 12th, disorders of memory. Disorders of memory are present as amnesia, hyperamnesia, and paramnesia. 13th, Jensen syndrome, otherwise known as the syndrome of approximate answers. This is an example of psychologic paramnesia characterized by approximate answers. For example, questions: how many legs do cows have? And the answer is 3. Somatic conversion features: pseudo hallucinations, clouding of consciousness. 14th, disorders of thought. Thought disorders are of 4 types, that is disorder of form, disorders of progressions, disorders of content, disorders of positions. 15th, disorders of intelligence, and the 16th one is disorders of insight and judgment.